Hi, my name is Dr. Bobby Solomon. I'm a periodontist and dental implant surgeon. I wanted to apologize, first of all, for communicating with you through this iPad. Due to new restrictions and the protective gear we wear, with the face mask and the shields, it will be very difficult to communicate. So I wanted to make sure you see my face and we can communicate clearly through this message, and I'll be glad to answer questions that you may have after watching this short video. You have been referred to see me for your missing tooth. The best and one of the most common ways we replace missing tooth today is a dental implant. They're currently standard of care and have many benefits over the conventional treatments such as dental bridges or partials and dentures. One of the biggest benefits of a dental implant is that it doesn't harm the other teeth, and we do not shave them down to put a bridge on. This will make it easier for you to keep it clean and hygienic, and therefore the implants could last many years longer than a bridge. Depending on how many teeth are missing, you will need anywhere from one to multiple number of implants. The time it takes for placement of a dental implant is approximately anywhere from 45 minutes to 2 hours, depending how many implants you may need and what type of procedure you're having. In many cases, if a dental implant needs to be placed, you may not have sufficient amount of bone if the tooth was lost more than 3 months ago, or if you had a severe infection that caused severe bone loss to the site. Procedures that we commonly do to build up the bone, such as ridge augmentation, bone grafting, and a sinus lift, which I can explain in the short videos that you will see in a few minutes, will explain those additional procedures that many times may be needed to make you a proper candidate for implant placement. Once the implant is placed, there's a waiting period of 3 to 6 months, depending on which location in your mouth the implant is placed. After the implant has fused to the bone, we will test it, make sure that it is strong enough to withhold a crown and you are able to chew on it. In most cases, implants could last a lifetime, or at least as long as your teeth will last you. But they do require maintenance and routine cleanings. They will never need a root canal or have a cavity, but if they're not brushed and cleaned and flossed properly, they will develop gum disease and they will fail and be rejected. There's a very small percentage of implants that are rejected, usually less than 2 to 5%. The cause of it could be multiple different things, but don't worry. If your implant does get rejected during the first year, we will replace your implant for you at no charge. With any dental procedure, there are some common risks, which will include swelling, bleeding, infection, and possible rejection of the dental implant. Although these are very rare, and we will give you proper medication to prevent them and make sure that you're comfortable, there are still something that you need to be aware of. There's a proper consent form that you'll be given, and we would like you to read it and sign it before we proceed. One of the key factors in dental implants is the healing time. For the lower jaw, it could take anywhere between 3 to 4 months for the implant to fuse to your bone, and for the upper jaw, it could take 5 to 6 months, given the fact that you may need additional bone grafting. After the proper healing time, the implant will be exposed by doing a small procedure to allow the implant to be accessed, and after a few weeks, your dentist will be able to fabricate a crown, a custom abutment, and restore your tooth back to full function. We look forward to serving you and answering any questions you may have. Thank you.